Good afternoon and welcome to all of those gathering at the European Parliament today for the launch of the European Heart Failure Mission. I am sorry I cannot join you in person, but I am glad to give my support to this important and timely mission. Through membership of the European Union, we can use our collective power in the face of shared challenges and opportunities. This includes the common goals of increasing life expectancy and improving quality of life, along with building sustainable societies and healthcare systems that can meet these aims. Ireland, and indeed all European Union member states, are signatories to the United Nations Sustainable Development Goal 3.4, which has set a target of reducing premature mortality from non-communicable diseases by 1/3 by 2030. Research shows this has proved challenging. Therefore, we need to reflect upon what must be done differently going forward, and this is particularly important in the field of cardiovascular disease, which remains the leading cause of death and loss of quality of life across Europe and the West. What is clear is that we must do more to prevent, predict and protect against cardiovascular disease at all stages. Public health measures will be vital in reaching this goal, but so too will be more structured prevention, care and management for those who need it. For example, today 15 million people live with heart failure in Europe, and it remains a leading cause of preventable hospital admissions. It is sobering to reflect that the number of cases of heart failure may rise by as much as 90% between 2019 and 2040. This is, however, only a projection, and we must make it our mission to avert that future. We have a long way to go in understanding how to best prevent this condition before it occurs. But this will be essential as structural changes to the heart, or so-called pre-heart failure, have been shown to be present in as much as 11% of those aged 40 or over. And this demonstrates that additional vigilance and early intervention is critical, and new approaches to detection and prevention pioneered. It is not too late to seek to prevent crises and hospitalizations for those living with heart failure. Guideline-based management can reduce hospitalizations by as much as 35% and dramatically increase quality of life. Yet we need faster progress. The prognosis in heart failure remains challenging. Quality of life and survival rates are worse than in many common forms of cancer. In particular, we need more effective treatments in heart failure with preserved ejection fraction, where therapeutic options have only just become available. And so heart failure is also an opportunity. Today we will hear more about how the European Union's existing competencies could transform research, innovation and best practice exchange to help defeat this complex syndrome. We welcome a Europe where members work together to build a deeper understanding of the diverse causes of heart failure, and where we develop new diagnostics, therapies and models of prevention, care and patient support that can be expanded at scale. We have a compelling precedent set in other areas, such as cancer, from which we can draw inspiration. Ireland has a proud history of leading new initiatives to combat cardiovascular disease, including the progress that has been made in implementing the Healthy Ireland. In 2004, we became the first country to ban smoking in workplaces, a measure that has been adopted in countries right across the world. We are supportive of a recent position paper authored by the National Prevention Council for a first ever national cardiovascular prevention strategy in Ireland, targeting all phases of the cardiovascular pathway, including in heart failure. We therefore note with interest the current calls by many European stakeholders for a European-led cardiovascular plan, and invite the Heart Failure Policy Network and its members to present suggestions to my government for the forthcoming Irish presidency of the Council of Ministers in 2026. We also welcome the growth of European Union-led global collaborations in cardiovascular disease, specifically in heart failure, with Europe's strategic partners such as the US, Canada and the United Kingdom. Finally, I wish you a successful event and look forward to learning more of the outcomes of your discussion. My thanks to my colleague Billy Kelleher MEP and his team for their support in hosting this event today. Let me close with my final words of encouragement to the Heart Failure Policy Network and its members for leading the debate in this vital field for a sustainable and healthy future across Europe. The need is real, the time is right, and your efforts are appreciated. Thank you very much indeed.